Helping the survivors and families in Uvalde heal. The focus in Austin today, even as lawmakers investigate the response to the school shooting. Thanks for joining us this midday. I'm Tashara Parker. The Special Senate Committee investigating the shooting that killed 19 kids and 2 teachers holding a second day of hearings today. Our Suzanne Bruner has been listening in. And Suzanne, what are they actually focusing on here this morning?
This second hearing is focusing on 2 things: mental health and firearm safety. So the Texas Child Mental Health Care Consortium talked about the services they make available to schools across Texas and its program called Texas Child Health Access through Telemedicine, also known as TCHAT. It provides access to mental health services for students. Right now, 40% of schools across the state utilize these services, and the consortium confirmed today that Uvalde schools are not a part of that 40%, but they are actively working with state and local officials in providing mental health support to students and families in Uvalde following the Robb Elementary School shooting. Now, one of the biggest challenges they're facing right now is a staffing shortage. They need more counselors who need to get trained.
If we don't have the workforce there to provide the counseling services to our kids in the schools, we're not going to be able to identify issues early, provide them the counseling they need, the services that they need to get them on the path that they need.
And here's a look at some other challenges they pointed out. The second one being getting more school districts to sign up for their services. The third, parental consent. They said in order for children to get this type of care, their parent needs to approve. And if the parent declines, they said counselors don't see the child. This was a concern for folks in this hearing and continued conversations about how they can continue to get kids help who need it despite parents disapproving. Now, the consortium's goal this summer, they said, was to expand services to more school districts because they found it's been very beneficial for children and their families who do use it. Now, we are still waiting to hear more about firearm safety. We'll keep you updated. Tashara.